William, you're up first.
Excuse me. Chairman Schweikert, Ranking Member Sewell, members of the subcommittee, good afternoon. My name is William Hild, and I'm the Executive Director of Consumers Research. Our mission at Consumers Research is simple: to increase knowledge and understanding of issues impacting consumers and to ensure their freedom to act on that knowledge. So I appreciate the opportunity to testify today as part of our continued public education campaign. This year, we expanded our consumer education initiatives to include nonprofit health systems nationwide that leverage numerous funding streams from the federal government and benefits from tax-exempt status to advance controversial political and social causes rather than serve their communities. And often, the advancement of political agendas such as DEI, gender ideology, and climate activism is easier to find on their public-facing web pages and materials than actual prices for their services. As part of our efforts to educate consumers, we issued a consumer warning detailing how several large tax-exempt health systems have devoted critical resources to infuse everyday operations with progressive ideological goals. These initiatives include instituting large-scale DEI bureaucracies, promoting gender ideology to children, and supporting environmental activism. At the same time, hospitals are pushing political agendas. Many fail to comply with healthcare price transparency rules and proportional growth in charity care. This misprioritization of politics over patients distracts hospitals from their core mission and can compromise the quality of treatment and increase costs, which can put consumers in serious physical and financial danger. Let me put this in perspective. Under Section 501c3 of the Affordable Care Act's added 501r obligations, charitable hospitals are supposed to operate for public, not private interests. The community benefit standard was intended to ensure that in exchange for tax privileges, hospitals would provide measurable benefits: affordable care, financial help, and improved services. Nowhere in federal law are discriminatory programs, the mutilation of minors, or investment in green boondoggles required. Through our research into hospital programs, public-facing materials, and leadership statements, we documented cases where major nonprofit health systems, such as Cleveland Clinic, Vanderbilt University Medical Center, Henry Ford Health, Memorial Hermann Health Systems, and others, funneled resources into DEI, promoted environmental activism, and performed gender mutilation procedures on children. The deliberate choice these health systems are making to prioritize political activism are concerning and costly. They require staff, program budgets, marketing, and other resources. Every dollar placed into a DEI policy is a dollar not placed into price transparency. Every dollar used for gender ideology is a dollar taken from charity care. Every dollar put towards environmental activism takes money away from staffing or capacity expansion. Are hospitals counting these programs as meeting the community benefit? Without clear and verifiable reporting, neither Congress nor taxpayers can answer that question. Tax-exempt status and access to federal funding, grants, and savings programs are public privileges. Congress has broad authority to condition those privileges on transparency and patient benefit without dictating medical judgment. Improving outcomes for patients is a worthy goal, and many hospitals do important work in this area. The oversight problem comes when community benefit is used as a vague justification for engaging in partisan political activity. Congress could require line item disclosure and outcome measures for any equity spending that is claimed as community benefit. Initiatives should focus on quality of care and patient outcomes, and hospitals should show the data. Hospitals are civic institutions that hold public trust. Nonprofit hospitals receive generous privileges because Congress expects them to deliver measurable community benefits. When systems elevate discriminatory policies, activist climate campaigns, or allow gender mutilation of children, this trust fails. Congress can restore this trust through more precise definitions, verifiable reporting, and alignment of privileges with the value patients receive. Thank you for the opportunity to testify. I welcome questions.